As a profession, for all the extraordinary advances in the art and science of medicine in the last 4 decades, we have too often failed our patients. We fail to follow proven guidelines, and we fail in the art by not seeing the unique person in front of us. We know their genome, but by not listening to their story, we don't register their broken heart. We fail to see the neurofibroma that are raising lumps all over their skin, a finding that is relevant to their paroxysmal hypertension, but that does need the gown to come off during the exam, does need our attention to be on the body and not on the screen. We miss the incarcerated hernia that explains an elderly patient's vomiting and have to wait for an expensive CAT scan and a radiologist to tell us what was before our eyes. Countries with the biggest expenditures on healthcare lag behind those who spend much less in basic rankings, such as infant mortality. I think it's very telling that deep medicine opens with a profound, personal, revealing anecdote of the author's own painful and harrowing medical encounter that was a result of not being seen as an individual, someone with an uncommon disorder. It shouldn't surprise us that technology, despite the dramatic way it has altered our ability to image the body, to measure and monitor its molecular structure, can also fail just as badly as humans fail. The glaring example is in the electronic healthcare record systems, EHRs, currently in use in most hospitals. These EHRs were designed for billing, not for ease of use by physicians and nurses. They have affected physician well-being and are responsible for burnout and attrition. Moreover, they have forced an inattentiveness to the patient by virtue of an intruder in the room, the screen that detracts from the person before us. In Intoxicated by My Illness, a poignant memoir about a man's ultimately fatal prostate cancer, Anatole Broyard articulates a wish that his urologist would brood on my situation for perhaps 5 minutes, that he would give me his whole mind just once, be bonded with me for a brief space, survey my soul as well as my flesh, to get at my illness, for each man is ill in his own way. This poignant declaration, from the era just before electronic medical records, expresses the fundamental need of a sick human being. It is timeless, I believe, resistant to change, even as the world around us changes. It bears emphasizing, each man and woman is ill in his or her own way. I'm excited about the future, about the power to harness big data, by their sheer capacity to plow through huge data sets and to learn as they go along. Artificial intelligence and deep learning will bring tremendous precision to diagnosis and prognostication. This isn't to say they will replace humans. What those technologies will provide is a recommendation, one that is perhaps more accurate than it has ever been. But it will take a savvy, caring, and attentive physician and healthcare team to tailor that recommendation to and with the individual seated before them. Over 2,000 years ago, Hippocrates said, "It is more important to know what sort of person has a disease than to know what sort of disease a person has." In a 1981 editorial on using a computer to interpret risk after exercise stress testing, Robert Califf and Robert Rosati wrote, "Proper interpretation and use of computerized data will depend as much on wise doctors as any other source of data in the past. This is a timeless principle, so long as it is humans we're discussing and not brake parts on an assembly line." We come back in the end to the glorious fact that we are human, that we are embodied beings, a mind with all its complexities and a body that is equally complex. The interplay between one and the other remains deeply mysterious. What is not mysterious is this: when we're ill, we have a fundamental need to be cared for. Disease infantilizes us, particularly when it's severe. And though we want the most advanced technical skills, scientific precision, the best therapy, and though we would want our physicians to know us, and unlike the time of Hippocrates, such knowing includes the genome, proteome, metabolome,